Hello, I'm Dr. Meenal Garg and I'm practicing as a pediatric neurologist at Surya Hospital in Jaipur. First of all, it gives me immense pleasure to be a part of these academic sessions being organized by One Zoe First Aid for the use of dentists all over India. I'm going to be talking about an important topic, that is, what to do if a child with epilepsy comes for dental treatment. As we know, the children with chronic neurological problems are at a higher risk of having diseases of teeth and oral cavity. So, we have to begin with the history. Ask the patient the duration of their epilepsy and the frequency of seizures. A child with well-controlled epilepsy who is on a lesser number of medications is unlikely to have a seizure. Children with poorly controlled refractory epilepsy or those who are on many medications should consult their pediatric neurologist before any procedure, because the doctor may advise them some rescue medication or some short-term medication during the procedure to reduce the risk of having a seizure. Ask the patient the type of seizures they have so as to identify the warning or danger signs of having a seizure early. Always ask the parents to give all the seizure medication before coming for any appointment or procedure, as it reduces the risk of having seizures. There may be triggers for some kind of seizures. Ask the parents if their child has photosensitive epilepsy, as the use of lights should be very careful in these children. The appointments should be scheduled during the time of the day when the child is least likely to have a seizure. For example, some children may have seizures during early in the morning and so on. The use of general and local anesthesia is not contraindicated in patients with epilepsy. In fact, in some children who may have other neurodevelopmental comorbidities along with epilepsy, the use of general anesthesia may be preferable. Always counsel the parents that in children with epilepsy, doing any kind of procedure can increase the risk of having a seizure. The parents and the child must be carefully talked to and counsel and explain the procedure, as it reduces the stress and anxiety and also reduces the chances of having a seizure. Now, what to do if a child starts having a seizure during their appointment or during a procedure? First of all, remain calm. Make the child lie down in a safe place. Remove all the objects around the child to reduce the chances of having an injury. The child should be in a Always counsel the parents that in children with epilepsy, doing any kind of procedure can increase the risk of having a seizure. The parents and the child must be carefully talked to and counsel and explain the procedure, as it reduces the stress and anxiety and also reduces the chances of having a seizure. Now, what to do if a child starts having a seizure during their appointment or during a procedure? First of all, remain calm. Make the child lie down in a safe place. Remove all the objects around the child to reduce the chances of having an injury. The child should be in a lateral position so as to facilitate the airway. Loosen the child's clothes. Do not crowd around the child. If the teeth are clenched, do not put anything like fingers, spoon, or try to prise the jaw apart, as it can lead to injury. Do not hold the hands and feet of the child. Do not rub or blow on them. Do not pour water over the mouth, and do not try to feed the child any solids or liquid when he or she is having the seizure. If the seizure lasts for longer than 3 to 4 minutes, then midazolam spray, nasal spray, can be used as a rescue medication. So, midazolam nasal spray is available by 2 or 3 brand names in the market and in 2 strengths. I am talking about the Pediatric midazolam nasal spray, which is available in 0.5 mg strength. So, this is the spray which has to be given in the nose. Before giving the midazolam spray, the child should be brought to a sitting position. Just take off the nozzle and spray like this in the nose. In children who are younger than 1 year of age, around 2 sprays should be given on each side. In children who are 1 to 4 years of age, 2 to 3 sprays can be given. In children 4 to 10 years of age, 4 to 6 sprays can be given. And in older children also, 6 sprays should be given on each side. After the spray is given, it takes some time or a few minutes to act. If the child has already been prescribed midazolam spray, ask them to bring it along with and ask the dose beforehand. If the seizure does not abort even after giving midazolam spray, then the child should be immediately taken to a hospital. In case of pediatric patients with epilepsy, the coordination between the parents, the dentist, and the pediatric neurologist is very important so as to minimize the risk of having a seizure during the procedure and to ensure a better outcome for the child.